My name is Kate Dewey, and I'm the Chair of Population Medicine, and I'm happy to be here today to moderate this section. Without further delay, I will invite our first speaker, Sujani, who works for the Public Health Agency of Canada, is our first speaker. Please help me welcome her.
All right, I'm gonna start my timer so I don't get that bell. I guess you don't have that bell, eh? Hi everyone, my name is Sujani and I work with the Outbreak Management Division at the Public Health Agency of Canada, and I was able to work on this outbreak, which was a multi-jurisdictional outbreak of Salmonella typhimurium, and it was associated with snakes and feeder rodents from a small network of breeders in Ontario actually, and a few other folks worked on this with myself and others at OMD, as well as Ontario, BC, and Quebec. And so today what I hope to do is describe how this outbreak played out and then take you through some public health actions and some exciting work that we're working on currently. And so this issue of animals and people becoming ill due to contact with reptiles and feeder rodents isn't new, because we've seen it in the past through multiple outbreaks in the US as well as the UK and Canada as well. And during that time, actually, there was a bearded dragon outbreak in Canada, and Public Health Ontario was also investigating that at the time. And so to give you a bit of background before I get into the outbreak that I'll be talking about is an investigation that Public Health Ontario did, and that was in early 2013. Ontario saw an increased proportion of phage type 10 cases compared with previous years, and so a lot of their cases were reporting snakes, and 60% of them reported directly feeding mice to their pets. And what they saw was, doing some traceback activity, they were able to trace a number of cases back to a certain pet store, and that linked back to a rodent farm that was also based in southern Ontario. And so based out of this work came a fact sheet that was distributed in the fall of 2013, I believe. And so the Ministry of MAFRA and Public Health Ontario distributed this to a lot of key stakeholders, and it was also available at reptile expos throughout Ontario. And so that was some good work that was being done. And then we kept seeing more cases of this PFGE pattern throughout 2013. And so by early December 2013, when I came in, we were seeing 25 new cases across 3 Canadian provinces. Majority of them were in Ontario. There was a few out in Manitoba and a few in Quebec. And so just some initial follow-up traced back to one rodent farm. And so a case in Ontario and a case in Quebec were purchasing rodents from a pet store, and that these 2 pet stores were sourcing their snakes from a common supplier in Ontario. And so shortly after that, cases continued to be reported, and around May 2014, we saw about 39 additional cases since Ontario's investigation. And so we decided to go in and investigate to really see what was happening and why we were seeing more cases. And so really the goal of the investigation wasn't to find the source, because we sort of had an idea of what the source was. And with preliminary information, we were able to pinpoint the source to being either like feeder rodents and snakes. And so the goal was really to conduct traceback and then to determine if there were common suppliers and to identify a root cause, and then come up with prevention strategies for the industry. And so when you do an investigation, you often develop a case definition, and what the case definition does, it allows you to count your cases in a systematic way. And so how we captured our cases were based on these factors. So they had to be a resident or visitor to Canada, and lab confirmation of Salmonella typhimurium, and the PFGE pattern of interest was 195-102. And we chose July 1st as our July 1st to August as our time frame, because as you can see, based on PulseNet Canada's uploads, there was this peak around that time, and so it was sort of like an arbitrarily chosen date for us to count our cases. And so just some quick demographics of the cases. So since July 1st, 2012, there were 107 cases. Majority of them were in Ontario that were being tested with Salmonella typhimurium and that PFG pattern of interest. And the median age was 16, and about 26% of them were 5 years and under. There were 15% of them were hospitalized, and no deaths were reported. And so this is just an epi curve showing you the illness onset dates for these cases from July 2012 to August 2014. And so what happened was we re-interviewed just the 2014 cases. So we went back to these cases and asked them a series of focused questions based on their pets and sort of their behaviors when they do take care of their pets or clean up after them. And so one question we asked was just general pet exposures. And as you can see here, based on the proportions, cases did not have just one pet. A lot of them had multiple pets. And so when a few of us went down to the expo in September, we were able to see that, and a lot of the attendees of the expo were actually buying their third or fourth snakes, for example. And so here you see that the top three pet exposures were first rodents. This included both pet and feeder rodents. Reptiles and dogs followed that. And I'll be focusing more on reptile and rodents. And you can see compared to the control data, the exposure of reptile and rodents is significantly higher among our case population compared to the control population. And that control data comes from Food Book, and that's a study that's being conducted at the agency. I won't be getting into that though. And so if you look at specifically reptile and rodent exposures, 88% of reptile exposures were specific to snakes, and 88% of rodent exposures were to feeder rodents. And so all of the snakes were being fed feeder rodents, and these findings are significantly exceeding the estimates obtained from Food Book, where only 1.7% of people out of that study reported having any exposure to rodents or insects used for reptiles. These are some other findings, not particularly relevant at the moment. So people are feeding both mice and rats, mostly mice compared to rats, and most of them fed their snakes frozen rodents, less live. We also found that some cases weren't actually directly exposed to their snakes. So either a son or a husband had a snake, but the mother just never went by there or never touched it. So this goes to support some previous studies that indirect exposure is also a risk factor. And so just being there in the environment where the snake had been is also a risk of being infected with Salmonella. And some additional questions we asked was on case awareness and prevention practices. And you can see that more people are aware that Salmonella and reptiles had an association versus Salmonella and rodents. Only 30% of cases were aware of that. And then it's a good thing that a lot of people reported washing their hands after handling the reptile food or the reptile in general. But no one was washing their hands before touching the reptile habitat. This was particularly interesting because when I went to the reptile expo, the vendors would have snakes on display, but if anyone wanted to touch their snakes, they were enforcing sanitization of their hands, but no one was sanitizing their hands as they were leaving the sort of the stations, right? So then you might wonder why the snakes weren't the focus of the traceback, and it was the rodents that we were focusing on, and primarily comes out of Public Health Ontario's great investigation that they had done. And in addition to their traceback activities, there was also a positive rodent sample that was collected from that store that I had shown earlier, and it did match the PFG pattern that was reported by the cases. And we also looked at snake ownership, and majority of the cases reported having owned their snakes for over 6 months. So the factor that the snake wasn't the one that was changing in the household, but rather the rodents that were coming into the houses every week or every 2 weeks was a changing factor. And so that's why we're more focused on the rodents. And so our traceback focused on the rodents, and you can see the diagram here. This was what came out of the traceback work, and although you can't see exactly what's on there, it's more to illustrate the complexity of the traceback. And so the left side shows all the cases and the pet stores that they purchased from and where the pet stores source their rodents from, and then back to the breeding, sort of like the facility or the farm that was actually growing the rodents. And so, not sure if you can see the flow of the arrows, but there was a lot of two-way flow. So it wasn't just coming from the farm to the distributor to the pet store to the cases. There was always like two flow of rodents. So sometimes you had a customer who was growing rodents in their basements would come back to the pet store and resell them because they had too much, and that pet store would sell it to another case. So there was that tracking that was difficult for us, as well as no record keeping or very minimal record keeping. And a lot of these stores were actually local stores based in southern Ontario and not franchises who had more record keeping. And so because of that complexity, we chose to focus on more of the linear cases, the cases that bought a rodent from a pet store who sourced it to a single distributor who went back to a farm. And so you can see here that 8 of 11 cases exposed to feeder rodents with detailed traceback information were traced back to 3 rodent farms. So that's A, B, C here in the green circle. And Farm C was actually traced back during the Ontario investigation as well. And we were actually able to find an intimate link between Farm C and Farm B. And so the story here is that in May 2012, Farm C actually sold half their business to Farm B. And if you look at this graph, that was when we started seeing that peak. And so one of our hypotheses was that possibly there was some difference in either how the new farm was growing their rodents, or something must have happened here for the increase in the cases during that time. But unfortunately, we weren't able to go and test out these hypotheses, because during the time that we were sort of planning to go visit these farms, Farm B had gone out of business and Farm C was in the process of going out of business, and then Farm A had a different issue and they were depopulating their rodent population. And so we came to a dead end to test out these hypotheses. So we did do additional testing at the pet store level, and the Animal Health Lab in Omafra, they did phenomenal work to get this done, and as well as a lot of the public health inspectors. I think Jane is out there. She also collected samples for us out in Hamilton. None of the samples came back matching the PFGE pattern. There was one positive Salmonella typhimurium, but it wasn't the outbreak strain. And so some conclusions and key findings. One thing is that we are seeing ongoing cases right now, and it's probably because of the dispersal and how they were selling it. The farms were selling live breeder females, so it's possible that people were using these breeder female rodents to potentially feed their snakes. The shelf life of frozen rodents, people often stocked up, and so these would be still sitting in their freezers, and potentially some other unidentified source that we weren't aware of. I guess I'll move on to the recommendations that we presented to the industries. There were 4 of them. Was one on point of sale education to customers, good management practices at the industry level, and record keeping, as well as notifying the customers once a zoonotic disease investigation was taking place. And so that leads into the public health actions that we took at the end of this investigation and sort of throughout. One was a fact sheet that was developed by Public Health Ontario, as well as some of the other partners in Ontario in the fall. And the Public Health Agency of Canada also came up with a fact sheet that's available on the website, and we distributed these at numerous expos. There was also a public health notice posted so that Canadians were aware of the investigation. Another cool thing that we had done was industry engagement. So we are invited to the Canadian Reptile and Exotic Pet Breeders Expo, and so this is a 2-day expo for reptile owners, and one day before that, we were able to present the investigation and sort of have a discussion with the industry about those recommendations that I had just presented in the previous slide. And the next 2 days, we sat at a booth and spoke to the public about Salmonella and reptiles. And currently, we're involved in some work, which is a series of infographics that we're developing with with partners across the country and experts to try to create key messages that would be going out to customers across the country at pet stores. And so we're hoping that we could either get these posters up on walls in the pet stores or packaging or shipments that are going out, just so that people are aware of the risk between Salmonella and reptiles. And just some pictures from the expo. That was during the industry engagement talk and our booth. And that's it. I think I'm over 11 seconds.
Thank you. Do we have some questions? Yes, go ahead.
Is there any reported case of an outbreak with typhimurium is not involved in this reptile-rodent connections?
Sorry, can you repeat that?
Typhimurium. Is there any other silver?
So there was a Salmonella cautum outbreak that happened during the same time, early 2014. That was with bearded dragons, and that was in the States, and I think there was one in Ontario as well.
Other questions? I would like to know if people have cultured these same salmonellas from the snakes. Do the rodents transmit them to the snakes?
So that's a good question, and I think they did some sampling of the snakes as well, and the problem with that is snakes have Salmonella on them in some points, and some points they don't, so it depends on when you sample them, and you could get a whole load of Salmonella on any of them, right? And it's about, I think the main point of the investigation was to sort of come out with recommendations to both the public and the industries on how they could go about reducing the risk, and a big part is education and making that information available to them.
Thank you. No problem. Any more questions? Thank you so much.
No problem.